All right, well, let's get started here. Hello, everyone, and thank you for joining us today. We're here today for our live vitamin D talk with Dr. Paymon Sadrolsadot, ND, PhD, and we are so excited to have him presenting today. Dr. Sadrolsadot is going to talk about the impacts of vitamin D on overall health, and attendees will have the opportunity to ask questions after the presentation. Dr. Sadrolsadot is a highly skilled naturopath with over 20 years of integrative medicine experience. He is trilingual and has a wealth of experience and medical training spanning multiple disciplines from around the world, holding licensing in China, Iran, Canada, and the United States. Dr. Sadrolsadot's areas of focus include chronic disease, mold candida, Lyme disease co-infections, chronic fatigue, fibromyalgia, integrative cancer treatment, mistletoe treatment, women's health, hormone balancing, insomnia, infertility, pain, stress management, skin conditions, neurological problems, and more. He is a licensed board-certified doctor of naturopathic medicine and on the faculty of Virginia University of Integrative Medicine. His deep knowledge of conventional, complementary, and integrative medicine allows him to think deeply and find solutions for his patients' health. His approach is always very gentle and specific to each patient's personal needs, and I am sure you will see this for yourself today. This talk is for informational purposes only. Dr. Sadrolsadot will speak in general terms and is not dispensing medical treatment. Folks who are interested are encouraged to schedule a comprehensive visit with him. I'm going to turn it over to Dr. Sadrolsadot, who will now speak and then open it up for questions. Due to limited time, we do ask that attendees limit to one question per person. Thank you so much, and we'll turn it over. Dr. Sadrolsadot, welcome.
Thank you, Angela. Thank you for the full introduction, and I'm happy to have another opportunity to discuss more about health topics, and this time about the vitamin D. I was actually thinking, like after last time that I had the talk, now this time what topic would be best, and kind of a little bit chatting and kind of going back and forth. I said something that is basically like needed for everyone, every topic, every discussion, a general kind of impact over the body. So I picked the topic for vitamin D. I hope you guys also will like that. So I start with the slide that I have prepared. And I believe you guys see my screen, the vitamin D's impact on human health. So some general, basically, discussions or introduction about the vitamin D. As you know, vitamin D is basically one of the fat-soluble vitamins in our body. So talking about the fat-solubles, vitamin A, D, E, and K. And basically, the different routes, different ways that we can get the vitamin D, or the main ones, the sun exposure, the diet, and how much we bring the supplements like the vitamin D through the supplementation. So back to discussion about fat soluble, it's something very important that if you are supplementing with vitamin D, it should be after meal. So very common, I hear from my patients, like when I ask, when do you take the vitamin D? They say early morning, like when I wake up or after I wake up. So if that is the case and there's no food in the digestive system, imagine a fat-soluble vitamin will be only absorbed if there are fat particles in GI system. So that's how absorption it can basically, the time of supplementation can have a huge impact over the amount it is absorbed. So always we say for vitamin D, the best time to take it is after meal, and ideally after the largest meal of the day. If it's the dinner, that would be the best time to take it. With regards to how, when it enters to the body, how body kind of process it, the two organs, liver and kidney, should be in a healthy state so that the vitamin D that is supplemented, this can be basically become active form, the form that the body can use it. So 125 hydroxy. And if you say the huge impact over the body, different areas, if you talk about the bone cells, the bone health, so diseases that come with basically lack of vitamin D, rickets, osteomalacia, the cell growth, we will talk about these like neuromuscular function, immune system, probably one kind of role that especially after the pandemic was more highlighted and people started taking vitamin D, and especially higher doses of vitamin D was to boost the immune system. And the time after COVID, especially when there was not the time there was no vaccine, or even after that, as a great way for treatment and optimizing the immune system, a lot of people kind of learn more about the vitamin D. Glucose metabolism, so these are all other factors that vitamin D can have an impact on. With assessment, which basically is a major, the main way we can have an idea how body, how we are good with the levels of the vitamin D, is just to do the serum evaluation. So there are basically 25 hydroxy vitamin D, which is assessed depending on the kind of labs. If you are in North America, you see that the kind of readings are not nanogram per ml, but also if the reading is done in other countries, you may also see nanomole per liter. So there are ways to kind of switch them together or change them together, like the same number. If it's in nanogram per ml, you multiply this by 2.5, that comes to nanomole per liter. But that's again, like if it's done in another country and the readings are different. And for testing, your doctor, basically, this is what your doctor does. Normally, the 25 hydroxy is checked because the other form is not much stable. So this is basically what your doctor normally checks. That is 25 hydroxy vitamin D. What I have here, because always the question can be how much of vitamin D. So I try to kind of start this discussion from a very evidence-based and what we have as guidelines. Then I will go to more discussions of what we do in practice. And also at the end, I have one article to show that the range can be very flexible. So what we have here on this chart, it says the recommended dietary allowance by NIH. So if you go to the NIH website, you see this chart. And what is interesting is the levels are technically small. So from 19 to 50 years, and even from 50 to 70, the numbers are 600. So 600 international units per day. So you see the what normally we refer to this numbers, because there are two type of reading. If you say 600 international unit per day, that equals to 15 mcg, microgram. So normally we prefer to go with this one, like the 600. So with that, it seems that the 600 has been decided to be good enough. And then above 70 years old, the NIH recommendation is 800 international unit per day. Now, I brought that because even there are not one fixed agreed number. If you say the FDA approved numbers for basically vitamin D, that's a little bit higher, just slightly higher. So the FDA approved for people for age and above. So almost the majority of the population is 800 international units. So then always the question is what will be the maximum dose, and how we can basically make sure that the vitamin D is in the normal healthy range. These are the recommended numbers. The only way you can make sure that your vitamin D numbers are good is to do the serum check, to do the lab test and see where are you with your numbers. because you may be on these numbers and your vitamin D levels can be low. I will show you in a kind of study done over 4,000 people, over 4,000, or almost 2/3 of the population were less than the normal range. So these are all recommended, but doesn't mean that it will guarantee that your vitamin D levels will be well in the range. Some of the food sources for vitamin D, you see them here. So fatty fish, trout, salmon, tuna, mackerel, and fish liver oil. They are all rich in vitamin D. Then other sources, again, you see here, beef liver, egg yolk, cheese contain small amounts of vitamin D. And to smaller levels, you see mushrooms, some mushrooms, especially those treated with ultraviolet light. So these are the kind of main foods that they have vitamin D. So if you say a person is following a vegetarian or especially vegan diet, and these are not included in diet, so basically the top two sentences, at least from the route of food, there will be no vitamin D or minimum vitamin D getting. So it will be only depending how much of light or sun exposure and how much of supplementation the person receives. You see fortified foods. It says most of the vitamin D in diet comes from fortified foods like milk, dairy, breakfast cereals, orange juice, yogurt, especially if they mention that it's like there's vitamin D or fortified with vitamin D. And for infants, the formulas by regulation, by the basically this is a mandatory fortification that happens in US. So there's a formula how much of vitamin D in how many kilocalorie of the formula. Now, looking to the same thing from more specific numbers of how much we get. So we see the numbers here. There are basically international. Usually we work with this unit, the international unit per serving. So we have it here. Cod liver oil, 1 tablespoon will give you 1,360 international units of vitamin D per day. So this seems to be, that is the top one on this list. And that is that would be a very good route or source of receiving daily. And so it says the percentage of the daily value. So how much of that? So it's definitely above 100% based on the numbers we checked. But it's a very good number. And then it continues. Trout, like 3 ounces will provide 645 international units. Salmon, mushrooms, milk. So you see the numbers just go down and become smaller. So 2% milk, that is only providing 120 international units. And then again, the chart continues. This is the chart is on NIH website, so you can easily search and Google that. It's there. So sardines, egg, liver, tuna fish. But what is interesting, from one level down, it's 0. So here, like when it comes to the vegetables, broccoli, carrot, almond, apple, banana, rice, so 0. One more time, if a person is following a vegetarian or vegan diet, other than the sun exposure and how much the person gets from sun, it should be the supplementation route. So this is very important. That's potentially how in the study that I will share with you at the end, which is done in Ohio, like in Cincinnati, Ohio, the average level of vitamin D for people was 27, like less than what is considered to be normal. Like the range for vitamin D, like the serum level, is from 30 to 100, right? This is like such a wide range. And over 4,000 people who were evaluated, the average number of the vitamin D serum was 27. So it was like almost everyone as an average, if you say, people were deficient. We talked about the food sources. The second route is the sun exposure and how much our body makes the vitamin D. Obviously, basically the exposure, the time of the day, the season, and then where we are, like with the latitude. The higher the latitude, like the more close to the north, the effect of sun will be less, or the way that the sun is the rays come like in a less direct way, so the exposure will be less. So all of this, and then one more thing that is here is skin pigmentation. The more pigments in the skin, which translates into darker color, the more difficult for the rays to pass the skin layer and to reach to the layer below to make the vitamin D. So make it easy. Dark skin individuals, they need higher doses of vitamin D compared to the light skin, just because the pigmentation makes a kind of make it difficult for the sun to reach to the layers below. And if you say, what are the guideline, which if we can do it, that would be ideal, but they say at least 5 to 30 minutes of in a day between the time that there is better exposure, 10 a.m. to 4 p.m., at least twice a day on the face, arms, hands, and legs. So all these areas should be exposed. And if that is the case, then the amount that is called sufficient. And then when we say sufficient, is just like 600 or 800 international unit per day that is considered to be the sufficient. That will be made through the sun exposure. But still, immediately the caution that is discussed is this: ultraviolet radiation is carcinogen. So it's not advised to get the vitamin D through the skin, because here excessive exposure increases the risk of skin cancers. That's a top kind of way to protect. Always the discussion is to protect the skin with like the creams with high SPF, like 15 or higher, and in that way the vitamin D, when there's a coverage, the vitamin D will not be made. Yeah. So you see the route of diet. Well, there are certain foods that if we have them in the diet, we check that in the previous slide to some extent, and then the sun exposure, especially during the winter time, less sunny days, sunny month of the year. So this is also not a very practical way. Potentially supplementation would be the main way to make sure that the vitamin D is in the body. Now, with some of the basically the discussion was about health effect. Probably the most discussed or confirmed is the bone health and the prevention for osteoporosis. Why vitamin D and bone? The reason is the optimum numbers of the vitamin D improves the absorption of the calcium from the digestive system. So if there is calcium coming to the body, either it's food rich in calcium or basically supplements, and the vitamin Ds are low, or technically deficiency in the vitamin D, the absorption of calcium will not be good. So even if a person is trying to supplement with calcium for osteopenia, osteoporosis, still it will not be practical because the vitamin Ds are not optimal. And that's potentially how nutraceutical companies, they came to this conclusion: if vitamin D is important for absorption of calcium, why not put them together? So a lot of times you have supplements, it says calcium plus vitamin D. Like they put small amount of vitamin D to guarantee that the calcium supplementation is effective, just to improve the results. So For sure, there is a confirmation for studies on postmenopausal women. Older adults show that vitamin D and calcium supplementation increase bone mineral density, reduces the fractures in the institutionalized individual. So that's very straightforward about the vitamin D. There is one discussion potentially proper to mention that right now, and that is the vitamin K2. And the way that calcium absorption increases, so there will be more calcium in the blood. What is important is the calcium that is in the blood travels to the right place. What is that right place? The bone. So calcium should go and sit in the bones. If not, then calcium can circulate and potentially the walls of the arteries, that can be the area that the calcium can sit. So that will be the discussion about like the atherosclerosis and formation of the atheroma plaque, which we don't want to happen. So what can be effective here is adding the vitamin K2. So when vitamin D is plus the vitamin K2, on top of many other great things that it can help activating the vitamin D receptors, it will kind of support the movement of the calcium to sit in the right place, the bone, and not in the wrong place in the walls of the arteries to make the atherosclerosis. So that is very important. I have that also in one other slide that will be best when you take the vitamin D that is also combined with K2. Not vitamin K1, because K1 is for bleeding, K2 is the one. And usually with the supplementation, the two come, basically the two items are put together, vitamin D plus K2. The other effect of the vitamin D is about discussion of the oncology, which is very important. Imagine, like the studies suggest that vitamin D may inhibit carcinogenesis, slow tumor progression, and have various anti-inflammatory, immunomodulatory, and anti-angiogenic effects. So all of them are good for a discussion about a person with cancer. There are a lot of studies to make a link between the cancer and the low levels of vitamin D. When you read basically the studies, it may not give you a very direct link when it comes to cancer. Cancer is not like one cause, is a factorial. Like when it comes to cancer, what is the genetic, what is the diet, what is the lifestyle, what is the level of vitamin D? So it's one of the many things we check. It's very difficult to make a one kind of link, but some studies have confirmed that there is like people with more diagnosis, there has been more kind of lower level of vitamin D. Controversy is always is the case, but not only for the link for the diagnosis or potential formation of the bad cells. Down the road, when there is such a diagnosis, there is improvements with the prognosis. So the outcomes for treatment, if it's a chemotherapy, if it's the any other treatment that is done, this optimization of the vitamin D guarantees the outcomes. So I think I have that also here. Some studies suggest association between the vitamin D levels and increased cancer incidence and mortality rates. So like the low vitamin D will have more potential incidence and mortality rates. But again, there are all type of studies, and the ones that confirms, the ones that do not confirm this. One more thing that I have here that could be potentially another slide on its own is this term, immunomodulatory. So balancing the immune system, modulating the immune system. Sometimes immune system can be less active. Sometimes immune system can be very active, too active, and cause the problem. What is that? Autoimmune disorders. So if the vitamin D actually can have a role of immunomodulatory, like balance the immune system. If it's too angry, if it's too active, it can calm this down. And the other way, if it's less functioning conditions, a person gets sick frequently, it can optimize the level of the immune system. So this is on its own potentially kind of separate slide or separate discussion, just to say we don't have many items that have this immunomodulatory effect. One of them is the vitamin D, and that just shows how important can be the vitamin D in this discussion. I go with the next slide, probably a little bit faster, the cardiovascular system. This is a very interesting, basically, information. Regulate blood pressure, vascular cell growth. Again, kind of balances the inflammatory pathways. And one more thing that is, I was really impressed is this one. Each 25 nanomole per liter, which if you translate this divided by 2.5, that comes to 10, like each 10 unit of increase in your serum level. If you have done your test is 30, and now you're optimizing your level of vitamin D to 40, then it says each 10 units links to 10% lower cardiovascular event risk. And cardiovascular event is the first cause of death in North America. So such an important kind of connection, and these are all by evidence. The like majority of information of this slide is coming from NIH. If you go to NIH and type vitamin D, you will just see exact same information. So this is huge. And again, like we know the range is really wide, but even with that, a lot of our patients are less than the lower end of the range. Like if you say 30 is normal and like your numbers come back at 31, your doctor says, yes, it's just normal. There is one thing, it's normal, yes, in the range, but is it the optimum number? So that will be a second discussion. That's how we try to keep your basically our patients' vitamin D in a more optimum number. But even that, the number 30, a lot of our patients come below that. So no wonder this kind of risk of cardiovascular can be discussed. And more stuff, the total cholesterol, blood pressure. So they have been in kind of confirmed in some studies, but then again, like all type of studies are available. So to be fair, both of them should be discussed. The connection of the vitamin D with depression and basically mood disorders. So it says the vitamin D kind of is involved in the brain processes with receptors present in areas linked to depression. So especially during the kind of winter time or darker, less sunny month of the year, the role of vitamin D potentially to avoid the depression. So that's probably what we can say. So it says associate low vitamin D levels with depression risk. This is what the observational studies always, the kind of trials may confirm, may not confirm, but this is what people definitely can see with a lower level and potential kind of more risk of depression with vitamin D. Multiple sclerosis, another thing, and that can be on its own a very interesting discussion. Why countries that are kind of closer to the North Pole or on the higher latitudes, the rate of the multiple sclerosis is higher. In Europe, in England, like Finland, Sweden, all those countries that are higher in terms of latitude. Canada has one of the highest levels of, unfortunately, multiple sclerosis in the world. So is it that they get less effect of sun? And just like what we discussed in terms of how much sun can be effective, is it like that? It can be one question. Again, it's a multifactorial, but definitely the countries that are at a higher, this is just statistics, countries that are at a higher latitude, the rate of multiple sclerosis is higher. So It can be, as I said, as to geographic multiple sclerosis distribution, vitamin D's role in the immune function. Again, you know that the multiple sclerosis is one of the autoimmune diseases. So the disease that the body starts a fight, an unfortunate fight against its own cells, and that is the myelin sheath of the nerves. So when the myelin sheath of the nerves are damaged, then all the sensation, like nerves are more exposed, all the pain and tingling and all those pins and needles kind of sensation and the disability that comes with that can be experienced. Some studies has highlighted their connection with type 2 diabetes. Again, diabetes, another multifactorial disease. Obviously, the statistics is huge. 1 out of 10 in North America is diagnosed as diabetes, and even higher than that with pre-diabetes. So the statistics for pre-diabetes is almost 2 out of 3. So people in combination of those who are diagnosed and those who are not diagnosed, just pre-diabetes, that is much, much higher. So some links here: low vitamin D increased the diabetes risk, but it says findings may be confounded. So again, like this is very difficult to judge about the diabetes. It's one of the diseases that runs in the families. So so that can be definitely a genetic role for that. However, always when it comes to genes, there are what we carry as what is dictated in our destiny, the genes, but also how well we can keep the bad genes in check. That is the diet and lifestyle, how much our life decisions can have a role for these bad genes to be activated or just to be kept in check. So the discussion about the genetic and oncogenes, like the bad genes, and then the one that are basically within our control, the epigenetics, like the diet, lifestyle, that will be another important discussion. Now, the discussion, again, like we are just strictly following the recommendations from NIH. If the vitamin D is used or brought to the body at a higher dose, there's a potential for extreme doses. So what are some of the extreme cases? Calcification of the soft tissues. You remember I mentioned about the adding vitamin K2 to make sure that the calcium sits in the bone, does not sit in the walls of the arteries. So that's here. So that's how we would like to add vitamin K2. So to the vitamin D, if your vitamin D is already kind of combined with that, or you just separately kind of use the vitamin K2, usually the doses are 50, 100 to usually maximum 200 mcg. That's the dose of the vitamin K2 that are included in the supplements. So that can be discussed and kind of addressed. Sun exposure, what is interesting is even a person is exposed to sun all the time, it's unlikely to get toxicity from sun, because even if the vitamin D production continues, it will be switched to inactive form, which will not add to the level of the vitamin D. So we don't have such a discussion about toxicity with sun exposure. Body knows how to handle this. Like the physiology does that naturally. Tanning beds, so that can be another way. That's basically another way to get the vitamin D. The only thing is when you take a supplement and you know it's 1,000 international unit per drop, that's it. But when it's like exposure to basically tanning beds, you don't know how much of vitamin D is made unless you frequently check that with the blood tests, which is probably, like always for vitamin D, we say vitamin D itself is a very like it's not expensive. It's a very basically cheap supplement. The testing is the one that is more expensive, the challenge. So with tanning beds, we don't know how much of vitamin D has made, and unless the person kind of monitors that with testing. But at least when you take a supplement of 1,000, 2,000, 3,000 international unit, you have an idea how much is coming to the body. Of course, still that needs to be checked with the serum levels. And then another thing that can be subject to increased absorption of the calcium is the kidney stone, and that's basically calcium type of kidney stones. This one still this one can be monitored. Number one, we always check for family history or past history. Like if a person has ever had the kidney stone, the history of the kidney stone, or someone in the family, because that makes it more potential. Number two, always to reduce the risk of kidney stone, hydration, hydration, hydration. So how much the person can drink and keep the body hydrated, because the more the flow, the less potential for formation of the kidney stones. And this is something to keep on radar if we want to go with the high doses. So high doses, really, really high doses, coming closer to the 100. Because the 30 to 100 is considered to be normal range. Not everyone or not every practitioner keep it at 100. Certain conditions, certain situations, we would like to see it at the higher end of the normal range, but just to say that the kidney stone risk is there. And potentially you might have heard about more people with kidney stone after the pandemic, when people kind of started supplementing with more vitamin D, and with such a kind of history, if that was the case, you potentially have heard some people experienced the kidney stone. Now, you remember we talked about 600 international unit and 800 international unit. Now, what the NIH agrees and says that is tolerable level of intake for vitamin D, that's what we have on this chart. So again, if you say we follow the recommendation of the NIH, now we see that here. And again, like these are all information on the NIH website. If you say for like all the ranges are here for male and female, from 1 to 3 years up to 2,500 is considered to be okay. 4 to 8 years old up to 3,000 international units are considered to be okay. And 9 to 18 years old, and actually after that, so basically after 9 years old, all the adults and seniors, 4,000 international unit has been accepted to be a normal range. It doesn't mean that we have to do that. Always, always, always testing to see the serum level is the most important way that a practitioner wants to approach. But if you say like the numbers that have been kind of agreed on and kind of is okay to go with, and doesn't end up with an extreme levels of vitamin D, that's what we see basically here for, let's say, adults age 9 and like from age 9 and after, because that's the same thing from 19 years plus, 4,000, 4,000. During the pregnancy, same thing, lactation, same thing. So it seems that that number of 4,000 international unit is kind of agreed number, at least from the NIH website. Interaction with certain medication, the kind of list of medication is here. You see them, corticosteroids, the basically anticonvulsant. If it's for fat, if the person is, it's interesting, if a person is taking some medication to lower the fat, sometimes the way that, or the mechanism that the medication works is to not let the fat to be absorbed. And remember, we mentioned that the vitamin D is a fat soluble. So in a way, the person is taking medication to avoid fat to be absorbed. And then the other way, we would like to supplement. So these are contradictory. And there should be some other ways to discuss. Is it an injection that the person should do, or is it other ways like let's say the sublingual that the person should take to make sure that there is no interaction that way. Antacids, the diuretics, certain medications for convulsion, the phenytoin. So the list is there just to say that we also should be aware of this potential interaction with the other medication. Here, what we mentioned is all like, let's say, safe NIH type of recommendation. A lot of practitioners, when you go online and kind of watch people's like doctors recording and ideas about the numbers, no one talks about 600 international unit per day, 800. They just blame the numbers to be very low, and the potentials with so many conditions about oncology, cardiovascular, you remember, like the diabetes, multiple sclerosis, all what we mentioned, there is a blame that these numbers are not good enough. And then definitely we see a deficiency in the population. So the recommendations should be higher. But I try to keep it at what is recommended and what is there as an evidence. This is a study that is done, and it's very interesting. The vitamin D3 supplementation in hospitalized patients. The PubMed ID, PMID is here. You can search it. You will see the full article. PMID, if you can put it also in the chat, that would be great. 3061198. So this is, if you just Google search the PMID, the article will pop up. So this is the one that I mentioned. It has been done in Ohio. It's been done in Ohio, and perfect. Thank you, Angela. So it's been done there, and I just close this. And the number of patients that were checked, like there were 4,700 from 2011 to 2018. So the time the article was published was 2018. And they gave the supplementation from 5,000 to 10,000 international unit per day. So that was a decision of the hospital for their patients. And even some patients who had much higher doses, 20,000 to 50,000 international unit per day, but not many. Like there were few that they decided to go with those numbers. What is very interesting is they mentioned no cases of vitamin D induced hypercalcemia or adverse events observed. So with the 5 to 10,000, and this is all evidence, with the 5 to 10,000 international unit per day for such a huge population, 4,700, there was no adverse effect. So we talk about all potentials, but again, we try to be fair. What we see here, that 5 to 10,000, it seems that, or at the by the results of the article, it seemed to be safe. There were certain conditions that they went even higher. I think the dose were 20,000 per day, and they were difficult to treat psoriasis cases that they were actually improved. And on the same article, the statistics are very interesting. So they said, okay, they measured the blood serum level for the patients, and this is what they got, 28.7%. So over a quarter. Their serum levels were less than 20. You remember we said 30 to 100 is the normal range. So over a quarter, and still 64% less than 30 nanograms. So 2/3 of the population, like 4,700, 2/3 are statistically, by the numbers that we have, they are low. They are deficient, vitamin D deficient. And they actually measured the average vitamin D numbers. The average numbers were 27.1. So average number was still less than 30, like from the lowest 4.9, and then the highest they had 47. So just dividing by the population, that was 27.1. And the conclusion was long-term supplementation with vitamin D3, and like the majority got 5,000 to 10,000, deemed safe and effective in hospital patients with potential clinical benefits observed in certain conditions like psoriasis. I highly advise you to just find the article and basically review it on your own, because always when it comes to articles, there's a kind of comment, is it North American, is it not North American? This is just done in Ohio, and this is a reliable, like with such a huge population, this is definitely a reliable number to go with. So I try to talk about like part that is more evidence, and even the article that we had is evidence, but you see there's a range that the vitamin D can be discussed. We always say the best way to kind of have an idea for treatment is to run the blood test, to have some basic numbers to see where we are, and then start from there to make sure that the practice is safe. Okay, and Jenla, I stop here as we still have.
Thank you so much. That was amazing. So much wonderful information. We are going to open it up for folks to ask questions. We don't have a ton of time left, but if you can use your hand raise feature if you have any questions. And then Dr. Sadrolsadot will go ahead and try to answer those.
Okay, by the time that there might be some questions, couple comparisons between the like there are forms that usually medical doctors prescribe. 50,000 international unit, which is given for once a week. Always a question is this better form compared to daily dosing of the, let's say, same amount, but just divided by the 7 days of the week. So if you have that 50,000 international unit compared to the daily dosing, obviously the daily dosing is better, because imagine if your digestion at the time you're taking the 50,000 is not good, if there's not much of fat in the digestive system, how much of it is absorbed compared to the kind of regular daily intake. So all the kind of comparisons confirm the daily dosing better than the basically once a week type, which is very common if your doctor prescribes it for you. The supplementation, if it's a drop, if it's a capsule, any type, again, like if it's daily, that will make sure that your vitamin Ds are increasing better. Like honestly, in terms of clinical practice, to increase the numbers of the vitamin D, this is just not easy. In practice, we kind of run the test, we see the deficiency, we start the supplementation, and then it will take some time and a lot of consistency, of course, from the patient to increase the numbers, and all the discussions we mentioned about the timing. Is it like taking after the meal, or is it like the daily dosed, or is it like ideally a drop form? Still, capsule forms are good. Sometimes the drop forms can be absorbed faster, but these are all things to discuss. And just to say that vitamin D is not like a B12 injection that you get the dose easily. It takes time, and like there are more discussions around that. Sometimes people talk about like the receptor resistance, and there are more things that your doctor, if numbers are not coming up, there should be some problem somewhere. Is it about the absorption? If a person doesn't have good secretion of bile and absorption of the fat, because that's how the vitamin D will enter to the body. Is the vitamin D is coming to the body but not effective, like there's a receptor resistance. So there are further discussions your doctor should evaluate. Just to say that the vitamin D, increasing the dose definitely takes some time and consistency.
I'll ask a question.
Sure.
My intention is to protect my bones. I've got some osteopenia in my bones, and I've also I have my blood calcium levels on the higher end of the bell curve. It's a little bit out of range, but not to the extent that they think there's a problem with my parathyroid. So what I worry about is that the hormone level, the parathyroid is taking calcium out of my bones because I have a lot of calcium in my blood. So my question is about vitamin D. If I take it as a supplement, you did mention hypercalcemia. What do you have any recommendations for me as far as dosing? Should I,
Have you run
know,
do you know your serum numbers?
for
For
my calcium and yeah,
vitamin
I
D?
do.
Yeah, so that would be one way to add for you specifically, considering the higher level of calcium in the blood circulation. Probably two things are very important. One is the vitamin K2, as we discussed, to make sure that the calcium just sits in the right place and doesn't kind of circulate in the walls of the artery. And the second thing is maybe your vitamin D, as far as it's just in the normal range, that would be good enough. You don't want to increase it to the level that normally we go for, let's say, what we call optimum number. For you, I think as far as it's just in the range, let's say, again, like I should see all the test numbers, but just past 30, those numbers, I think that would be good enough, because the probably main concern would be the parathyroid and how the calcium, because calcium should be kept in a proper range, and you don't want your body, like, I don't know what is the problem with the parathyroid for you, but for the vitamin D, I just think if it's just in the range, that's good enough.
Yeah, yeah, and not go above that. Don't overdose or anything like that. Yeah, I
Just
am supplementing
vitamin K2, yes.
with K2 and vitamin D, just to keep at least vitamin D in a good range, but that 30 mark is good. I'll try to aim for that. And I just can't get a diagnosis as far as my calcium level. Like it's around 10.2. And I'm not supplementing at all.
Yeah, that should
So
be further evaluated, the reason why
Yeah.
calcium is on the higher end. Yeah.
And I
So
did
you
put
think
some information. Oh, sorry, go ahead.
so you think that should be evaluated? I should pursue that
For sure.
more.
Yes. Are you on any blood pressure medication?
No.
That's another thing too. Yeah. Yeah, it should be further evaluated. You mentioned something about the parathyroid. I'm assuming that's the connection, but I think that could be further discussed.
Yeah, I just can't. My parathyroid is level is normal. You know, it should be low. It should be very low with that kind of calcium level, but it's not. It's just kind of normal. I've put. I mean, I can't get a diagnosis because every doctor saying, well, 10.2 is not that high. You know, they're looking at higher levels for, you know, treatment or surgery or something like that. So I'm just kind of in this wait and see from my perspective. It's just like wait and see what happens. But I don't want to be aggravating some situation that I don't.
Yeah, I think with regards to vitamin D, as far as it's not deficient, that would be good enough. You don't want to go high because that can increase the calcium numbers.
And I did put some information too, just for all folks here, obviously, and this is just a brief talk, but there is information on how to book a comprehensive visit with Dr. Sadrolsadot in the chat here. And we do have one more, looks like, question in the chat, and then it seems like we are hitting that 3 o'clock mark here. So what is the difference
I have my
between...
hand up.
Oh, sorry, I'm not seeing the hands up for some reason on my end.
Yes, hands up.
Oh, my quick question. I have osteoporosis and it had increased with bone loss, but I noticed my vitamin D year over year. The previous year was at 93 and this year was at 46. So I'm wondering if that has a correlation in the bone loss because of the vitamin D level was reduced.
for sure, there can be a potential. However, what you mentioned, your numbers are good numbers. Like we would like to see numbers around like 50, those numbers, like that would be a optimum. Again, it should be individual case by case. But the first number you mentioned, 90 above, that can be potentially high. That can be
Yeah,
potentially.
last year it was 98.3 and this year it was 43.3.
So if unless there is a treatment that your doctor decides about, so let's say for my practice, when it comes to oncology discussion, I may increase the dose of vitamin D for the purpose of kind of treating the bad cells. But unless there is a reason to keep it at 98, I think that's a high number. So potentially around the second number that you mentioned, again, like I should have the whole context to make a better discussion. But the second number is more reasonable. But if you say, no, I have always been on the 90, 80, then your 48 is low. Yeah,
Okay.
I don't know that.
But I was concerned about the osteoporosis because it went from a negative 4.0 to a negative 4.6 on the T-score.
Right. It's definitely increasing the potential for the osteo. This is basically in the osteoporosis, like minus 2.5 above. So calcium level, that would be another thing to discuss. And how is your?
That's on point.
That's the absorption of calcium and kind of how much of that is in your diet. That would be another thing I would like to check. So going over the diet and potentially, are you supplementing with any calcium?
No, just a vitamin D.
Right. So such a discussion, I would definitely consider some support from calcium. Usually we aim for again, like I'm giving a general idea. I'm not doing any prescription, but usually we go for around 1200. And with a 1200 milligram per day of calcium, usually we say 700 of this can come from a good diet. Again, I'm highlighting good diet. It should be rich in calcium sources. And then still 500 can be with supplementation. So if you see that your bones are on a kind of like the numbers are increasing in terms of bone mineral density, and you're not supplementing with calcium, I think that would be a reasonable thing to consider.
And then the 50 milligrams of the K2 with that calcium?
Yes.
Okay, thank you.
Yeah, you're welcome.
Thank you so much, Dr. Sadrolsadot. Again, I can't see any hands up. We have hit that 3 o'clock mark. So if you see any other hands that I'm not seeing, maybe just grab the question from the chat and then we'll wrap this up.
Okay. Supplementation with D2 and D3, the regular basically supplement that we prescribe is vitamin D3. So all the regular supplementation is the D3. So that's my understanding. I don't think we basically aim for supplementation with D2, but the regular basically supplementation, that's with the vitamin D3. Like D2, basically, yeah, that's basically, normally we do D3.
Okay, excellent, fantastic. Well, thank you so much, Dr. Sadrolsadot. You covered so much information and just answered a lot of questions, and just really appreciate you and everyone for coming out for this talk today. We will be announcing more of these, and appreciate everyone. Have a wonderful rest of your week. Thank you very much.
Thank you, Angela. Thank you, everyone.
Thank you. Always a pleasure. Thank you.
Thank you.